Hi everyone. Today I wanted to talk about breast reduction surgery. Breast reduction surgery is a hot topic. There are millions of women in this country that are walking around with heavy pendulous breasts that it really impairs their day-to-day activities, such as exercising and other things. And typically, the weight of the breasts lead to different ailments such as neck pain, back pain, lower back pain, shoulder grooving, the indentations from the bra straps, sweaty areas underneath the breast. Sometimes there's rashes and infections as a result of the breast being so large and coming down onto the upper part of the tummy that the area becomes very, very moist. And so this is a really big epidemiological problem that can really affect patients' well-being, can sometimes lead to depression and things like that. Fortunately, breast reduction surgery can significantly improve people's quality of life by decreasing the neck pain, the back pain, sometimes completely eliminating it, and also taking away the odor and the rashes and the infections that women can get in the breast crease at the bottom. And so with the breast reduction surgery, a breast lift is also performed, the breast tissue is removed, and the incisions are closed. Typically, but not always, typically this is the scar that leaves the anchor incision, in which there's a scar around the areola, another scar that goes from the bottom of the areola down to the inframammary crease or the breast crease, and another scar that is in the crease itself, so it basically looks like an anchor scar. The scar is required in order to remove the breast, that amount of breast tissue, and to provide a breast lift. Sometimes what I've started doing with breast reduction surgeries in order to improve the shape of the breast is to actually use what's called pedicle shaping sutures. When we remove the breast tissue, we weigh it to try to remove the same amount of breast tissue on both sides if the breasts are equal, but if one breast is larger, obviously we remove a little bit more breast tissue on the side that's larger to try to improve the symmetry with respect to size. And then we send that breast tissue off, typically to pathology, to make sure that there's no concerns about cancer and things like that, and that's a routine thing. However, the pedicle shaping sutures, in other words, the remaining breast tissue, what I like to do is turn the remaining breast tissue into a nice round, almost like a nice round implant, and suture it to the top of the chest wall. What that does is it gives the fullness in the upper area, which is typically lost if you don't do that with traditional breast reduction surgery. And so I've been using that for many years now, and it's really, really helped improve the shape of the breast. And also what I also do in many patients, especially patients who are a little bit on the heavier side, is to do liposuction of the lateral bra rolls. What that does is helps contour those areas and actually makes the resulting new breast shape significantly better. And sometimes we can also talk about doing liposuction of the back and bra rolls in the back area as well at the same time as the breast reduction surgery. These are all options. I discuss these options with every single patient that is a good candidate for that, and ultimately, patients make their own decision about whether they want concomitant liposuction along with their breast reduction surgery. In any event, the procedure is done under general anesthesia. It takes about 3 to 4 hours to do, depending upon if other procedures are combined with it. You do go home the same day, and typically we use drains. The drains stay in for about a week or so, and we pull the drains in the office, and it doesn't hurt. In some instances, we take out the drain the next day, but the bottom line is the drains do serve a purpose, and it's not really does not cause significant discomfort from the procedure. In terms of the discomfort associated with surgery, the breast reduction surgery is actually not painful compared to some of the other procedures that we do. Obviously, there is going to be some discomfort, and I also use medication during the time of the operation to try to minimize the amount of discomfort that a patient can experience for a day or two after the procedure. Having said that, you will have some discomfort. The breast reduction surgery is one of those operations that you'll literally notice the difference in terms of the weight reduction almost immediately, pretty much the next day. And if you've ever, women who've had large breasts, if you've ever taken your breast and you've lifted it up and you've noticed the relief that you get when that happens, that is exactly what happened with breast reduction surgery. And a lot of patients are extremely happy with this procedure because they can start exercising and do all the things that they couldn't otherwise do. And it's a double-edged sword. Sometimes we tell patients, well, they need to lose weight first or do physical therapy. The problem is if you can't exercise because the breasts are too large, you're never going to be able to lose the weight. And so typically the breast reduction surgery can start the process of patients being able to start exercising and then losing the weight. So it really improves the quality of life from that standpoint. So hope this was helpful. This is a significant problem that many women are afflicted with, but fortunately, breast reduction surgery can significantly improve the symptoms and in many instances completely cure a lot of the symptoms that we just talked about. For more information, obviously, please visit my website to look at information about breast reduction surgery, looking at before and after galleries to get an idea of what the scars look like and what the shapes of the breast look like. This is an operation that has an extremely high patient satisfaction, and I will tell you that every single patient that I've operated on, if I asked them if they would do it all over again, they would say they'd do it in a heartbeat. So hopefully this was very, very helpful to you guys. As always, I look forward to the next video. If you have any questions, any other questions that you want me to answer, please put it in the comments section below. And I'll be sure to try to answer questions related to other aspects of plastic surgery. So as always, look forward to the next video, and thanks for tuning in.